Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor. And this is a video about quote unquote mandatory diets when patients are dealing with a yeast overgrowth problem. So, I don't believe that there are mandatory diets that people need to be on when they are dealing with a yeast overgrowth. There are certainly general guidelines that, for many cases, are very useful. However, in my experience, I've had patients, I've treated hundreds and hundreds of patients with yeast overgrowth issues over the years, and I have found that sometimes some patients need to be very, very strict with what one might consider to be a textbook anti-yeast diet. If you go on the internet, talk to different clinicians, read blog posts, etc. There are different versions of anti-yeast diets out there, and essentially, some of them are pretty basic, and then some of them are like laundry lists of foods that you need to minimize or avoid. And generally, it's talked more about avoiding them as opposed to minimizing them. And what I have found is that some patients, they'll get better from their yeast overgrowth syndrome, and they're still eating a pretty crummy diet. They're still eating, refined sugar and things like that, which would arguably be one of the biggest no-nos when trying to get rid of yeast. And then there's other patients where they need to be incredibly strict, and even fruit sugar can be problematic for them. So really the take-home message that I want to convey is that there really is, in my opinion, there's really no mandatory diet to get better from a yeast overgrowth syndrome. The way that I usually approach the dietary aspect of treating yeast, and this would be in addition to using herbs or other agents to help try to kill off the yeast and recolonize with good bacteria, and to make it a less hospitable environment for yeast to be overgrowing, and sometimes using nasal sprays or suppositories depending on where the yeast is overgrowing. So there's a bunch of little nuances that can come with treating yeast. But as far as the dietary aspect of things goes, it's really tailored to the individual patient, and depending on the severity of their symptoms, what they've already tried prior to coming in to see me, known triggers that they've already identified, then that's going to dictate what I'm going to recommend as a first-line approach diet-wise. And it might be, relatively loose dietary recommendations. It might be on the stricter end of the spectrum, and then we play it by ear as we go from there. And sometimes we need to remove or minimize a couple more foods as we go along. More often than not, we usually find that we can actually bring more foods back in sooner versus later, even before they're feeling 100% better. So if a patient, the approach I usually take is saying, try to minimize these foods as much as you can, but if they sneak into your diet, it's, here and there, it's not the end of the world. And if they do sneak into your diet here and there, it actually serves a dual purpose, because A, it gives you, just a little less stress. If you know that it's not going to undo all of your progress by, quote unquote, slipping on the diet here and there, that takes a lot of the pressure off. And then also for some folks, they find that it's just a really nice reprieve to say, hey, I know that if I have this or that thing that's off the diet, then they kind of look forward to that. People, of course, we as a species tend to enjoy food, and certain foods that might not be the healthiest for us, might be some of the ones that we enjoy a fair bit sometimes. So there kind of is that joy aspect to things of not being 100% strict. But the other advantage of not being 100% strict all the time is that you kind of get these semi-regular reintroduction trials to say, well, I'm doing better and better, and then I ate X, Y, or Z food, and I felt just as good, no worse for wear. It's great. Maybe you don't really have much of an issue with that food. Whereas if, they bring in A, B, or C food and they say, oh man, I started eating that, and I ate that for supper one night, or I was at a get together and I ate this thing that was off diet and I got really bloated again, or got really itchy again, or my symptoms flared up, my sinus symptoms flared up, then that gives us these real-time trials saying, wow, that food you should really probably try to stay away from as much as you can, because it seems to fairly definitively be causing you symptoms when you eat it. So it's really a tailored or individualized approach that we need to work with as a general rule when it comes to figuring out the best type of diet if someone's dealing with a yeast overgrowth.